My name's Dr. Hillary Van Horn-Gatlin, and I am a clinical psychologist at Kaiser Permanente, South Sacramento. I was a previous chair of chiefs of behavioral medicine and have recently changed jobs, but I was able to speak with you a couple of years ago. And today I'm going to talk a lot more about post-traumatic growth. And one of the things that I really want to highlight, and I think was important, that has come up through all the different speakers and specialists today, has been that a lot of what you're experiencing is normal. So much of the stress that you're going through, so much that you're experiencing is part of what we would expect. And despite all that hardship, you will also find that you change in ways that you may not have liked, but actually may make you stronger. And that is the concept of post-traumatic growth. So today, as we talk through what to expect, a couple things. The first is that I want to make sure that you understand the various markers of post-traumatic growth. You might already know some of this innately, but to think through what this means for you in your daily lives. And also, and I think perhaps most importantly, thinking about the internal and external impacts on your well-being that might foster post-traumatic growth or take away from it. So the first thing to know is that I have nothing to disclose. I have no other affiliations. And I want to start with this. I actually use this for my dissertation. My dissertation was on post-traumatic growth before it was really a well-known concept. And one of the things that I most love about this, Invictus, if you haven't read it before, is at the end where he says, I am the master of my fate. I am the captain of my soul. And one of the things that we often find with our families and our parents and the children that are going through treatment for neuroblastoma is just the exceptional stress that they're under. And despite that, you'll often find that you are so much stronger, so much more capable, and your perspective has shifted so much that oftentimes people will say, I don't know how you do it. And you're thinking, what are they seeing that I'm not seeing? How are they seeing me as being the strong person? I'm not feeling it myself. But part of what that process is post-traumatic growth. So to think this through, I want us to look at stress and a lot of the psychiatric complexities that come into play with pediatric cancers as family survivorship as opposed to just your child. Oftentimes families will be really and understandably worried about their child who's going through cancer treatment, or perhaps a sibling that is, left behind. But most psychologists in this field will say that we want to look at the family system. We're looking not just at your child who's going through treatment. We're not just looking at the sibling, but we're looking at this from an aspect of family survivorship, no matter where you are in your journey with neuroblastoma. So as we think about this, I want you to ask yourself a few things. The first is this. How has your perspective changed since neuroblastoma became a part of your life? Think about that again. How has your life and your perspective shifted? The second, how has your parenting changed? For better and for worse and for everything in between, how has your parenting changed? How do you connect with others now versus prior to your diagnosis? And I say diagnosis as a family system, again, not as just your child who's going through treatment. And last but not least, where are your priorities different? And I think every person listening right now would say, oh, all of this is different for me. This is a very, very different thing. And what I will tell you is that what we're looking at there is post-traumatic growth. And that doesn't mean that the trauma's over. It doesn't mean that the stress is past. It doesn't mean that this was a great thing. But it means that in all of this, we're also changing and shifting in ways that are good. Hold on. Is that better? Okay, I apologize. We had quite a few technological difficulties as we were working this through this morning. So I say this because I want us to remember there is hope. One of my favorite quotations in a recent article was, most research is focused on maladjustment and psychopathology. So when we're looking at pediatric psycho-oncology, we're looking at what goes wrong. And we have to. That's part of our job in making sure that we're taking care of families. But it also overlooks resilience in incredibly difficult scenarios. And so let's talk a little bit about what that looks like. What is resilience? So resilience is healthy or adaptive psychological outcomes. So shifts in who you are, how you look at the world, how you cope over time following something that's been really, really difficult. And so that looks very different in our families who are going through cancer. And so one of the things that we find is that both children and parents will say, I see grace and I see gratitude and I see benefit in places that I previously wouldn't have. They'll also say that I see these places of post-traumatic growth. And when we talk about post-traumatic growth, we're looking at 5 different aspects of post-traumatic growth. And you can have changed and shifted in one of these, 2 of these, or all of these, really. First is new opportunities. What's important to you? Have you had a change in career? Have you stopped working and you're at home and you're actually realizing that despite how hard this time has been, it's actually been a really good thing for you that you otherwise wouldn't have done? Changes in relationships with others. What relationships have you lost? What relationships have you gained? Where is there some pain and grief in that loss or disappointment? How has it changed how you just interact with other people? Another one, how do we increase our sense of our awareness of how strong we really are? A lot of times parents will talk about how strong their children have been. And I'll say, well, you are too. And they'll say, oh no, it's an act. But it's both. It gets to be both. And I think that that's one of the things that I think probably every specialist here would say is that you get to have both. It gets to be hard and it gets to be terrible. And in this, you also get to find this inner strength that you may not want to use and may feel exhausting. Another thing that we talk about is a greater appreciation for life. It feels so much more sacred. Or a deepening of your spiritual life. A lot of our families will say that they have a greater sense of religiosity or spirituality following their child's illness. And part of what we're looking at as we look at resilience and this trajectory of post-traumatic growth, which I'm going to show you in a moment, is this stress inoculation theory, which is this idea that moderate stress or a certain amount of stress, which is different for everybody and experienced differently, actually makes us stronger and more able to take on more. Because again, part of it is our perspective has shifted. What's important to us has shifted. What matters to us shifts. Where we put our time and our energy and our heart changes. And so we want to think about what that looks like socially in our relationships, how we address difficulties. How often have you heard from friends, I don't know how you do it? And what you're thinking to yourself is, I have to do it. I don't have a choice. But again, that's that adaptability to changing demands, whether we like it or not. And a lot of families will say, I have a greater sense of optimism. I have a sense of hope about a lot of things that otherwise I would have not felt. So as we move through this, again, this is what we talk about with this trauma trajectory. And I really want to highlight that within any family system, different family members will react differently to this stress. And that goes into a lot of different things. It can be a little bit of personality and temperament. It can be, again, adaptability, how flexible we're able to be. And it could be where we rest our thoughts. And we're going to talk about that in a little bit. And so you'll notice that some people, after a stressor has passed, so we can say that anytime from diagnosis to either remission, from remission to potentially a relapse, or really just from diagnosis and beyond, some families will say, you know what, we try to keep things as normal as possible. I feel like I'm doing pretty well. Other families will say, this was a hit on us. This was really hard. We still have not recovered. We still just are barely getting through, and that's, those kind of that really traumatic impact where we're not finding those other places where we're able to function. And oftentimes that's where we as psychologists spend a lot of our time. And you can have that and also grow in other ways. And I would argue that most of you here have grown in other ways, despite the fact that you may feel that you are just limping along most days. Which is, you have these places where you are stronger, grittier, and more capable than you previously probably saw yourself as being. So again, these are the different aspects of post-traumatic growth. And this was defined by Tedeschi and Calhoun, who were really the first people to start really looking at this closely. So I'm curious, as you look at this, how many of these you can identify with? Not necessarily fully. You don't have to tell me that you've made a full, 180 in this place and you're doing, significantly better. Of course not. Neuroblastoma is a journey, no matter where you're at on it. And can you give yourself, your family, your child, and I think especially most importantly yourself, credit for what you're doing well, or where you're growing despite maybe wanting to grow? So how do we foster post-traumatic growth? You might be thinking about this for your children, but I want to challenge you to also think about this for yourself. So the first is that it's really important to communicate. The more that we talk, and I think all of my colleagues here would agree, the narrative aspect of just speaking and connecting and sharing and therefore processing what's happening with other people is incredibly important. It lets you get different perspectives. It lets you feel support. It lets you feel connection. And that connection is so important because cancer is by nature a very isolating experience for a family. We also know that that is important as we think about how we look at our outcomes over time, and particularly life after cancer. One example was adolescent and young adult pediatric cancer survivors. And they found that in that specific group, post-traumatic growth was was a benefit to better psychological outcomes long-term. And again, it doesn't mean that they don't have anxiety. It doesn't mean there's some, post-traumatic distress, but it means that they can see that and they can also say, I'm stronger in these ways. I'm better in these ways. I have a different focus on what I spend my time on and what I value and what's important. I see myself as strong. And I still can struggle in these ways. And I want to really, if you remember nothing else, remember that it gets to be both and we hold them lightly together. And this goes to my next point, which is that it's independent of distress. So you can grow and still really, really have psychosocial issues and challenges, difficulties. You can still see a mental health provider. You can still talk to other people and it be hard, and have these places where you have a stronger sense of self or spirituality or relationship and connection. And finally, we know that survivors who experience significant post-traumatic growth can also be highly distressed at times. They can still feel a lot of anxiety, a lot of depression. And so recognizing both and still seeking out support if you're seeing some of those more difficult symptoms that are getting in the way of what's important to you and what you value are going to be key. So, as most of my families will ask, how do I keep going when I feel stuck? Oftentimes, families with neuroblastoma will say, it feels like we're walking through quicksand. It feels like there's concrete on my feet. I just don't know where to go and I feel stuck. So how do we move forward? Well, the first thing I want to assure all of you is that this, like your cancer journey, is a process. It's not a destination. There's going to be setbacks. And again, going back to our stress inoculation theory, that those setbacks, while hard, also in some ways can truly bolster our well-being and our sense of what we're capable of. Another thing that we talk about a lot is how do we reassign meaning? When things are difficult, it's common to think through the pain. It's common to think about the struggles. It's common to fixate on the people that we're disappointed in. And I think we can all connect with that. And can we reassign meaning to that as well? Can it be painful? Can we be disappointed and say, This is opening up space for me to invest in the relationships that are more important to me. Can we open up a space where, rather than personalizing and self-criticizing or focusing on something that's not moving us forward in any meaningful way, can we look instead at what it's also opened us up to? Can we find control and acceptance? We talk a lot about acceptance and commitment therapy, or, kind of radical acceptance, and this concept of this is happening. There are things that I can fight against and I need to. And the things I have no control over, where am I giving my time? Where am I giving my energy? So what can I do? I always say, imagine the worst. And we talk about this with anticipatory anxiety, right? Sometimes it's helpful to go with the worst case scenario because we think it's going to prepare us. And it does to a certain point. But if it's getting in the way of who you want to be, how you want to parent, how you want to feel in relationship with other people, or just your well-being, it's time to really look more closely at that. And finally, I really want to highlight the importance of compassion for yourself and for other people. This is a long, long, long road ahead, no matter where you're at with this. You're not alone. Right now, you're not alone. Tomorrow, you're not alone. And it's going to be difficult. And it's important to have compassion for yourself and other people and recognize when you're bringing the best of yourself, and that when you're not, that's simply an opportunity to forgive yourself, to seek out support and connection, and again, grow. So be patient. So if I leave you with nothing else today, a couple thoughts to think about. Who is your network? Who are your people? Are they what you need right now? Secondly, what are you struggling with? Beyond the obvious, what are the things you're struggling with? What are those bricks that are weighing you down? And of them, what is it time to make peace with? That control and acceptance, right? So that you free yourself up to what you can do. What do you need and how do you tend to it? Just like you tend to your child. And I think also, what do you need to give yourself more credit for? Oftentimes we're so self-critical and we're so disappointed in ourselves for these little bits and pieces that we feel like if I had just, or I should have, or I could have, those pieces that we play over and over in our mind. Instead, I want you to ask yourself, what have I done well? What do I need to give myself credit for? Think back to all the things that people have said to you about, oh, how strong you are, or I don't know how you do it. Go ahead and take that in and let that rest a little bit instead of disregarding it, ignoring it, or putting yourself down. And I think as a parent, the reason that that's so important is that your children learn from what you model. So are you modeling that so that they also have a chance to grow? And finally, just remember that what we water grows. I tell this to my patients all the time, and my teenage patients will always roll their eyes at me, but it's true. I want us to think about this. What we water grows. We're going through incredible hardships. And we're experiencing incredible traumas that most people can't even imagine. And it does not mean that we're doomed. Psychologically, emotionally, socially. So where are we putting our time? Where are we putting our energy? When we have those moments, are we doing things that help us continue to be the parent that we want to be, the person that we want to be? Are we giving ourselves space to think forward? And when we are looking back, and oftentimes with regret, can we challenge ourselves to say, what am I watering here when I think about this? Is this serving me in some way? Is this doing something for myself, for my family, for my child that is meaningful today and tomorrow? The answer may be no. And if the answer is no and you have a really hard time letting go, it's a great time to reach out to a specialist, a mental health provider, and take a closer look at that. Make sure that you're freeing up space for yourself and those around you. And so in conclusion, I really want to ask everybody to think through, how do we hold both the challenges and those changes gently for yourself and other people? You know, unfortunately, cancer requires an incredible amount of flexibility. And when we're under stress, none of us want to be flexible. And so how do we seek out support that's going to get us there, or simply remind ourselves when we're feeling that way? And last but not least, how do we use compassion and communication for ourselves and other people to build those relationships? And again, just think about kind of shoring up, our bone structure as we go through this.